I'm Carlo. I'm from Philippines, and yeah, I right now I'm currently studying here at Pacific Coast Community College, doing an acute care aid program, and yeah, and I'm right now I am on the co-op program and doing a private care, one-on-one care to a certain client with a rare kind of disease.
He's a quadriplegic, you said?
Yeah, he's a quadriplegic, and well, he can move most of the time, but he needs to use lifts or other to lift to he needs to use a lift to put him on chair or on the bed or in the toilet.
Would you say that the type of work or the procedures that you're doing here are different than what you were doing in the Philippines?
Yes, it's totally different. Even though I'm a nurse back home for 5 years, if I compare it here, my experience, my exposure to other facilities, uh, it's totally different because
So the healthcare assistant curriculum, that first 31 weeks, and then all the practicums, did that prepare you properly to be dealing with your current client, the quadriplegic?
oh yeah, it did. The way they taught me uh, from the practicums we had, first of all, is that uh, your patient client safety. They would teach you on how are the procedures to be done, and on yourself also, your safety. I mean, back home I was having this back problem because I didn't have that idea on how to properly do the body mechanics, for example.
Yeah.
And yeah, with with the exposure I have and what I have learned from the school, they taught me a lot of how to deal with that body mechanics, and it helped me a lot, especially from myself, from my back. But now it's getting better.
Is this a job that you would say is easy?
No, it's not that easy because, like I said earlier, it's very challenging, and though it's very challenging, it's also been a good experience and a rewarding experience for you because you will learn a lot from from the first practicums you have in the school from until now, still learning, and yeah, it will give you or it will benefit you a lot from your future endeavors in your life.
And then finally, the client that you have right now,
Yeah.
maybe one of the challenges is that it's not just his physical care, but you spoke earlier about his emotional care, and you're dealing with that almost as much as his physical needs.
Yeah.
But he has a whole team, I understand, right?
Yeah. Yeah. As you said, my client now has different, and his care is complex, from having from physically to emotionally. He could be very challenging because yeah, through physical uh, he needs total care, and from emotional standpoint, he doesn't speak clearly to you, So you have to have the patience to deal with him, and yeah, sometimes he would. There are certain times that he has tantrums, so you have to be patient a lot with this kind I had, and it's not only him, but you should. It's not only him that is the what do you call this? It's not only him. You should focus on it. You should also pay attention to yourself or you, because you might get drained or emotionally drained because yeah, he needs a lot of care from physical to emotional. His needs had to be met.
Well, you know what? You didn't mention it, but I know that there was a lot of people from a lot of different schools and locations applying for that job, and we were pretty impressed with you, Carlo. Okay, from the school, we were really proud to see that it was one of our guys that got selected for that job. So, well done, right? Congratulations, right?
You.
And thanks for your time.